So in the Iraq War, I was embedded. I've spent a lot of time embedded.
Think of any world conflict in the past couple decades, and there's a good chance Martin Savage was in the middle of it.
A number of tours in Afghanistan, Iraq, and then on top of that, the West Bank, Gaza, Lebanon, Syria, Bosnia, Kosovo.
I was at a U.S. base in southern Iraq.
One of the most accomplished journalists of his generation, Savage delivered difficult truths from every corner of the globe. But it was at home in December of 2021, far from any chaos, that he suffered a stroke at 63 years old.
It began on a Sunday, and I began feeling an odd sensation in my left leg and also in my left arm. I'd never felt anything quite like it, but if I was trying to describe it, I would have said it was feeling like my leg was falling asleep. There was kind of a numbness, but yet a tingling, and maybe a weakness.
He went to the emergency room the next morning, and a battery of tests showed he'd had a stroke.
I was dumbfounded. I was bowled over. I couldn't believe a stroke. That's something that happens to other people. It doesn't happen to me. I sort of believed I was invincible, having gone through so much and seen so much.
It was in December of 2021, and I was in Germany at the time working there with the Air Force.
At 33 years old, Joy Lomheim Nguyen was in the middle of a workout when she felt unsteady, numb, that her thoughts were slow.
The TV was on, so I thought to test myself. The remote was laying there, and it was just the most difficult, laborious task to change the channel. I physically couldn't do it. So, I knew something was very, very wrong at that point.
She FaceTimed her sister, who was a nurse.
She told me she saw, difficulty with speech. So that was one of the most obvious things. And then she told me too later, one side of my face was a little kind of paralyzed or, not moving compared to the other side.
Lomheim Nguyen had had a stroke. What she and Martin Savage had in common is that they'd had ischemic strokes, the most common type, where lack of blood flow to the brain causes damage or injury.
Nobody can.
Neurologist Fadi Nahab is the stroke quality director at Emory Healthcare and a stroke specialist who has participated in and led over 20 clinical trials and other studies regarding cryptogenic stroke.
You do the workup. The typical workup would be looking at your arteries of the head and the neck of the person who's had an ischemic stroke. You'll look at the heart via an ultrasound to look and see if there's a heart-related abnormality. You'll do blood tests to see if the person's diabetic or has high cholesterol. But literally 1/3 of the time, there is no identified cause of that ischemic stroke, and we call that a cryptogenic stroke.
I had never really been hospitalized.
Savage and Lomheim Nguyen
There were also
in that 1/3, which is where Dr. Nahab's research is centered, helping people uncover the root cause.
A key research focus for me has been on how can we improve testing? How can we improve our ability to evaluate patients and figure out very quickly what is that cause of stroke? What are those tests that we need to do? What are those tests that all doctors need to do when they are seeing a patient who has a ischemic stroke of undetermined cause and get to the bottom of it quickly?
Nahab says there are several causes of cryptogenic strokes: clotting disorders, cancer, migraine with aura, genetic brain-related causes, mild atherosclerosis in the head or neck, carotid web, autoimmune disorders, aortic atherosclerosis, silent heart arrhythmias, patent foramen ovale, and heart failure with reduced left ventricle pumping function.
Step one is
Savage fully recovered from his stroke, and testing determined what ultimately caused it.
you've had a stroke of undetermined cause without clear risk factors. We then now look and say, well, looks like your clotting activity is quite high and your lipoprotein A level is quite high, and we know these are factors that are associated with stroke risk.
Lipo-A is a type of cholesterol-carrying protein that can contribute to atherosclerotic buildup, increasing inflammation and risk of clotting. High levels of Lipo-A are genetic.
Some studies suggest that in the general population, the lipoprotein A level is elevated in anywhere from 10 to 30% of people. In cryptogenic stroke patients, our studies have shown that actual lipoprotein A levels are high in over 40% of people. Lipoprotein A itself has been associated with an increased risk of both heart attack and ischemic stroke.
The average person would have a level, when tested, of 30 or less. Mine was 293. I'm nearly 10 times normal. Okay, I'm gonna make tea.
Testing also discovered high levels of protein in Savage's urine from an autoimmune kidney disorder. Just 3 months after his stroke, Savage was back in the ER because of swelling in his body.
When I'm there saying, what's going on with this swelling? What are we gonna do about that? That's when the doctor said, right now we're more concerned with the fact that we believe you've had a heart attack. And so this is 3 health maladies in a row. I clearly had a kidney issue, I had suffered a stroke, and now I'm being told, in just a few months later, you've also had a heart attack. It was another huge blow to your psyche, because you're just, oh my gosh, what's gonna come next? This happens to be a doorknob from one of Saddam Hussein's palaces.
Doctors said the heart attack was due to the kidney issue. The pressure from water weight gain put stress on his heart. Savage's kidney condition is now in remission.
The most dangerous place on earth.
His heart is doing great. His high Lipo-A levels are genetic, but there are drugs in clinical trials that are showing promise in reducing levels, and he may be a candidate if they're shown to lower risk of heart attack and stroke. In the meantime, Savage lives a healthy lifestyle.
I exercise even more. I usually walk several miles a day, and I swim every day. I have become much more careful with my diet. I always was. I stopped drinking. I don't smoke.
Still, you just have a fear of recurrence, or you just don't know what to expect in the future.
Physicians in Germany determined Lomheim Nguyen had patent foramen ovale, or PFO, which is a small hole in the heart that didn't close properly after birth. It can allow blood clots to bypass the lungs and travel to the brain. While most PFOs are small and have a low risk of causing stroke, Lomheim Nguyen's PFO was large and considered a high-risk PFO associated with an increased risk of stroke.
What studies over the last decade have shown are that in cryptogenic stroke patients, while we say 25% of people in the population have a PFO that's present, in cryptogenic stroke patients, it's actually 50% of people who have a PFO.
Oh my goodness.
3 years after her stroke, now a new mother, Lomheim Nguyen is getting her PFO closed.
We are able to make repair of the heart or the valves.
Emory interventional cardiologist Vasilis Babalieros will do the procedure.
It's this trapdoor idea, because you have a septum that grows from the top of the heart and a septum that grows from the bottom of the heart, and they come together. They're able to trapdoor, but eventually they should fuse. In 25% of people, if you were to take an instrument and push on it, they would flop open, and some people you can even see it kind of vibrating. So it's a slit. It's a potential space for clots to travel from the legs or in the pelvis across to the left side of the heart that can go up to the brain.
The procedure involves a thin, flexible tube inserted into the femoral vein in the groin and guided up to the heart. Dr. Babalieros compares the closure device to a button.
They have some form of fabric and a little bit of metal, and it looks like a two-sided button. So we all know what a one-sided button looks like, but if you were to turn it, kind of inside out, you see a button on the other side as well. These products can travel through a long, skinny tube, and as we extrude them, they make a shape. The first button, we pull against the defect, and we open the second button, and then we detach it. So the most minimal of minimally invasive repairs, and this is a procedure that can be done in 20 minutes.
Lomheim Nguyen is doing well. So what are the takeaways? One, to prevent stroke in the first place with a healthy lifestyle. The single greatest risk factor is blood pressure, so managing it is key.
We want people to have a blood pressure where that top number or systolic number needs to be less than 130, and that bottom number or diastolic number needs to be less than 80. And why do we do that? We do that because getting that blood pressure less than 130 over 80 reduces your risk for heart attack, reduces your risk for stroke, and it reduces your risk for dementia. And so all of these things are so important and come together.
And if you or someone you love has a stroke and the cause is cryptogenic, unknown, Dr. Nahab's advice is to seek out the closest stroke center.
As a patient, if you have been told you have a stroke of undetermined cause, that cannot be sufficient. You have to go and seek out care at a specialized stroke center that can manage and do the appropriate evaluation